Hi class. As you know, there's no school Friday, so I'm going to be doing a podcast, a quick overview for the four of you guys that missed class Wednesday. What we're mainly going to go over today is a little bit of a review. If it comes out of my mouth in this podcast, you probably will see it again on the quiz. So we went over a lot of anatomy, parts of the skeletal system. The two subdivisions is really important, and there's a good video you can watch on Blackboard. But you have your axial skeleton and your appendicular skeleton. Those are important to know. So, what consists of those two types of bone? We'll go to that. We'll come back around a little bit too. Sorry about that. Didn't mean to go so far ahead. A little excited. So it also goes into talking about the functions of the bone. It supports the body, right? It protects soft organs. It allows for movement. It stores fat and minerals such as calcium and blood cell formation, which is also known as hematopoiesis. I have 206 bones, and the two types of bones are going to be compact and spongy. The two types of bones. So these are the classifications of bone. You got a long, flat, short, and irregular. Know an example of each. Example of a long bone is a femur. Example of a flat bone is ribs or the sternum. A short bone, also known as cubed shaped, is going to be your tarsals and your carpals, your wrist and ankle. And then irregular is going to be known of your vertebrae. So here's some pictures. Humerus is also a long bone, femur, and so forth. You can always go back to these PowerPoints, and these are giving you the examples that I just went through. Okay, this part's going to be kind of important to know, and a better diagram of this, I think, is in those papers I gave you. I've got to find it here. If you will go to these review sheets I gave you, can you see them? Hold on. These review sheets right here. Not very good. Okay? They started with 7 and they went to 10. Okay? These are going to be a better information for the next part. If I know how to get out of this. Okay. So we're going to skip to this picture here. It's similar to the review sheet on it's on review sheet 7. Okay, it's on the back. On the back. Okay. You will see a drawing of this. Okay. And on the quiz, you will need to identify these parts. So if you use, again, number 7, it says gross anatomy of typical long bones. And down here at the bottom is your best resource. See? It has each bone. The diaphysis is entirely a compact bone. Bone marrow is the site of blood formation, and so on and so forth. It's right there. You need to know those and read those. Or at least have this filled out. Okay, this is a little important. You'll see a few questions with this. Again, it was on page 82, review sheet 7, right here. Let me show you a whole page of that. This is it. Okay. What do the questions say? Let's see here. The function of the matrix is strength and flexibility of the bone. Okay. The important organic bone component is collagen. Salt, calcium salt, adds strength. Then it goes on to talk about the route in which the bone starts is the periosteum, ending in the osteocyte at the lacuna, L-A-C-U-N-A. So it goes periosteum, O-S-T-E-O-N, central canal, L-A-M-E-L-L-A-E, and then LUCA and osteocyte. Okay, and so you can see that picture. You'll need to know how to explain these areas. The central Harvard-Jackson canal is important. It runs lengthways of the bone. It carries blood cells and blood tissue. Important to know that. Okay, that's a better picture there. I just should have waited, huh? So know this a little bit here and what these areas are for. The Volkmann's canal also carries blood vessel nerves. It's a bone matrix and another good picture of it. So growth formation. This is the part we didn't really get to. So ossification is a process of bone formation. It occurs on the hyaline cartilage models or fibrous membranes. Long bone involves two major phases. Osteoblasts, which is bone-forming cells, cover hyaline cartilage model with the bone matrix, and in a fetus, the closed cartilage is digested away, opening a medullary cavity. This is kind of important in a growth. And so here's an embryo, and you can see the bone starting to replace cartilage. And then in a fetus, you see the bone will grow here. This is important. The epithelial plate cartilage, that also is known as a growth plate, that is going to stay open and present in children that are growing. And as long as you have a fracture that doesn't involve the growth plate, you are fine. But if your fracture involves the growth plate, it could cause some shortening of the limb. This is what closes once you become adult, and there's not going to be any new bone growth at that point. And so again, this talks about that. The cartilage is here, it's replaced by bone here, and it grows here at the growth plate or epithelial plate. So again, it goes through some more stages. At birth, the cartilage is converted to bone, except for two regions in the long bone, and this is the growth plate, and this is articular cartilage. New cartilage is formed continuously on external face of these two cartilages. And then old cartilage is broken down and replaced by bony matrix. So bone growth is also controlled by hormones, such as the growth hormone when you're a child and sex hormones. And I think the reason why they bring this up, this oppositional growth, is once you reach menopause, what happens at menopause? Basically, when women go through menopause, they are not producing any more estrogen and very little testosterone. So therefore, they're not regrowing or reforming is a better word. They're not reforming bone. They actually can develop bone loss. So low iron, low vitamin D causes factors of osteoporosis and causes the gravity of the muscle cause the breakdown as well. So then we didn't get to talk about fracture. It's just basically a break in the bone. You won't have to know every type of fracture. The two main important fractures are a closed fracture, and it's exactly what it says. It's a break where the bone doesn't penetrate the skin, and then you have open fracture, and that is where the bone goes out of the skin and is visualized, and that's called an open or compound. The way to fix it is going to be to immobilize it, either with a closed reduction or from surgery, which is called open reduction. It takes 6 to 8 weeks for bone to heal. This is a little important to know too, and it's basically the 4 major events of bone repair. I'm trying to see real quick if any of your papers went over that. I don't know that it did. So you may have to look in your book for this one. So basically when a bone is broken, and I think, oh good, there's a picture here. Here's the break in the bone. You form a hematoma because, you know, there's blood vessels in here. So you get some bleeding and you get a hematoma. Hematoma means blood, basically a blood clot, right? And then the fibrocartilage forms a callus right here. And it's an external callus. There's new blood vessels and an internal callus. And then you get a bony callus that forms. See how it looks a little bit different? And then the bone remodeling occurs. This happens in most people, except like I said, postmenopausal or people over the age of 50 have more difficulty with bone remodeling. So the axial skeleton, you need to know the axial skeleton. What is the axial skeleton? What consists of the axial skeleton? It's right here in front of you. Okay, sorry about that. Got a phone call. So the axial skeleton consists of the skull, the vertebral column, and the thorax, okay? Now, you need to look at this little guy. You'll need to identify a couple of things. Remember, I gave you the coloring pages, and that brings up something, I'm sorry, but I need to say it. On the coloring pages, okay, they're due as a homework. They're due, I really want to have them Friday by midnight, but because school's out, I'm going to make them due Monday. So Miss Amy needs to see your coloring page of this guy here so you can get your 5 points. I'm going to ask you a few questions about the skull. Remember that this is proximal, this is distal, proximal top, distal bottom. I'm going to ask you a couple of questions that are pretty obvious, like the humerus. This will be one unit known as the pelvic region, pelvic bone area, femur, patella, maybe tibula or fibula. So know this right here. This talks about the skull. I'm going to maybe ask a few obvious questions like the occipital or the that area. So just kind of look. Temporal is always going to be, everybody heard of the temporal area? It's the temporal bone. Frontal's in the front. And your parietal is here. And kind of just know those areas. Oh, I'm so sorry. It's late. The hyoid bone is related to the mandible and the temporal bones. The only bone that does not articulate with another bone. It's movable at the base of the tongue and aids the swallowing and speech. Can you picture it? This talks about the vertebrae. Not a lot of questions on the vertebrae. I'll get off on that a little bit. Cervical is always by your head. Sacral and coccyx is always lower, right? It does talk about a few problems such as curvature of the spine. We're not going to cover that, but you've got scoliosis. In adults, you'll have a curvature or a hump, but we're not going to really cover that. It's just too much information. Thoracic covers the sternum, the ribs, and thoracic vertebrae. appendicular bones, 126 bones, the limbs or appendages, the pectoral girdle, and the pelvic girdle. Okay. And I didn't really put a lot of questions about joints because we just didn't really get to go through joints, but read, know what they mean and what they're for. They help with movement, smooth movement of the bones. And basically there's cartilage and joints everywhere. Synovial joints, the reason why they're different, they always have synovial fluid. Okay. Like here, between the scapula and the humerus. Here, between the elbow joint, the wrists. Everyone knows you've got synovial fluid in the hand. Okay. That's it. Okay, let me see here. So, here is AMI, okay? I'm going to ask you to watch this podcast. It's a participation point. I'm going to ask you to to turn in the coloring page for 5 points. The 4 of you that were not there Wednesday, we did a lot of worksheets. You're going to be allowed to have these worksheets on your quiz. Therefore, you need to do your best to finish those worksheets. So I will give participation points if you show those packets to Miss Amy as well. Then we need to talk, what time is it? About 17 minutes. About your next assignment that's due. If you're done studying for your quiz, she's going to start in chapter 6. You've only got one and a half days for 6, so make sure you read that chapter and get ahead. This is what I wanted to point out. You have a current event due on February the 12th. And most of y'all did very well, but this is the thing. Me and Miss Amy didn't explain it in detail. But the current event needs to be a little better, okay? And what I mean by that is absolutely no plagiarism. These need to be in your own words. They need to be well written, paraphrased, with a reference at the end. So we don't want any copying or pasting. Here's the guidelines here. She's going to put a rubric with it. The rubric will tell you how she's going to grade. We're pretty lenient on the first one because we didn't tell you this, so I'm telling you now. You'll have a rubric. It needs to be in your words, paraphrased, no copying and pasting, and referenced. It needs to be a minimum of so many pages. You guys have access to all this on Blackboard. That's exactly where I'm at. That's me starting the quiz. The guidelines. So, okay, it needs to be a new article within the last 6 months. No less than 8 paragraphs. No less. You have to have 8 paragraphs. Typed. No direct quotes. Here's all the different ways that you have to do it. Make sure you look at that, okay? Alright, well, I hope everyone stays well. I hate that you guys are sick and school had to be out. I'll just have a few more minutes, less than a minute. I'm just going to go over the test real quick. Again, know the components of a bone. Right here. Know that. You're going to have some some associated questions with that. Know the function of the skeletal system. Know what protects your spinal cord. Know the different types of bone, long bone, short bone, an example of those. What's the process of bone formation? What's the first step in bone healing? What is your appendicular skeleton and what is your axial skeleton? You're going to have a little diagram like this little buddy that you've all dealt with. Okay, there's going to be a few things that you need to label on him. Again, very common, nothing crazy. Going to have a few questions about this little guy here. Okay, you've got this information. And then I've added a few bonus questions because I'm just in such a good mood. Know how the stages of bone healing that we went over last, difference between a compound or open fracture, and we've got a few bonus questions this time. Again, me and Miss Amy, we all want you to do well, and therefore it's why I'm taking the time to do this. Please watch this. Please have a great 2 days. Get well, do your homework, and you'll be sitting better with some homework and participation grades, and I hope to see better test scores, quiz scores. Thank you.